Why would someone want to do psychotherapy? Well, when people first come to psychotherapy, there's a lot of questions that they have to face into about what kind of therapy they want to do, what kind of therapist suits them, and how they as a person want to interact with a therapist. At the root of it, the reason people come to psychotherapy is because psychotherapy works. There are studies that show that psychotherapy has really good outcomes, at least comparable to medications for a lot of issues. So the real question is, for a lot of people, is how long is psychotherapy going to take? Now, that's a much, much more difficult question, because fundamentally there isn't an answer. Some studies show that certain therapies like CBT can be effective in 12 to 16 weeks. But most of those studies focus on single problems and reduction of symptoms. There's kind of limited capacity for, does this get any, does this really actually change a lot? So what most people find is that the longer you go to therapy, the greater the effect is. There's a study that shows that 40 sessions of psychodynamic therapy, that's pretty much a full year of therapy, shows a really good reduction in symptoms for most conditions, but also that when they followed up a year on from the end of the study, most of the participants in the study had continued to improve. So that's one of the major motivators for people to actually go to psychotherapy, is that potential for continuing improvement and the growth that actually comes with psychotherapy. It's not just about dealing with right now, it's also about getting ahead of things for the future. How do you stop repeating patterns that aren't actually working for you? Is behavioral change enough, or do you actually have to look at why those patterns exist in the first place? And that's the real question of psychotherapy.